Hi, my name is Jamie. I have a bachelor's degree in psychology and a master's degree in Christian counseling of substance abuse and addictive disorders. I was a licensed addiction counselor for about 4 years, did my internship at the Arizona State Prison. After that, I worked with children, and then I worked with dually diagnosed adults. Had a little midlife crisis, decided I wanted to write full time, and then I have somehow stumbled into the world of TikTok and lives and video creation. So here we are. This is my labor of love. Everything that I post here, if you can't stay, does get reposted to YouTube, although I am a few days behind. I'm almost caught up though. So tonight's topic is the mental health crisis in underserved communities, barriers, truths, and real solutions. Before we get started, I'm going to do just a little bit of housekeeping. I am no longer a licensed therapist, but if I was a licensed therapist, I am not your therapist, and I would not be able to provide any type of therapy services. Everything I say here is my opinion. It is an open discussion or is discussed lived experience, okay? I don't expect to be covering any triggering topics tonight, but if I do, just want to make sure that everyone in the US and Canada is aware of the crisis line 988. If you are located outside of those areas, you're going to go to findahelpline.org and they'll be able to help you with crisis counseling. All right, so tonight we're going to talk about a mental health crisis that I feel like does not get enough honest airtime. And what mental health services can look like in underserved communities. Not in theory, not in headlines, in real life. This is not going to be about blaming individuals. It is about systems, access, culture, history, and what actually helps. And I just want to do one more quick gentle disclaimer, just so that we're clear. I'm not here as a therapist. I am here as a mental health advocate. Even though I'm not in that field anymore, I'm extremely, extremely passionate about mental health and recovery as an advocate. I like to be here as the storyteller, but also somebody who believes that mental health care should not depend on your zip code, your income, or your background. When you hear underserved communities, what comes to mind for you? What do you think of when you hear that? It is not just like low socioeconomic or poverty poor areas, but that is one of the big areas. I'm in a rural community, and we actually have a system where the underserved get more services than like the middle class and the high income. Many of the middle class and the high income have to pay out of pocket. I love it. I absolutely love it, but it has created a system where you can't even go to these clinics unless you pay out of pocket, because if you have regular insurance and not Medicaid, oftentimes you pay out of pocket and have to submit a ticket to your insurance for reimbursement, or you have to pay out of pocket on a sliding scale fee, whatever. They really mostly cater to Medicaid clients, and that's because you can literally bill for everything with Medicaid clients. And I have a whole tangent. I'm not going to go off on it tonight, but I do feel like it is a little bit of a scam to make money, because as a therapist who provided services in that type of environment, which mind you burned out after 9 months, you have to make so many billable hours. And I understand they have a business to run, but as a nonprofit, it just feels a little bit scammy. Okay, so that's my thoughts on that. I feel like sometimes underserved communities do have it a little better in some areas, but they're more susceptible to people taking advantage of the Medicaid system. So, all right, we're going to go ahead and talk about barriers to access. Now, I think, and this ties right into what I was just saying about the underserved areas. Financial barriers are a big one. Financial barriers or just having insurance is a big one that oftentimes keeps people from being able to seek mental health care. And the reality is therapy is expensive. And even when insurance pays, unless you have like Medicaid, even when insurance pays, sometimes your copays and your deductible, especially with the way healthcare is here in the US, you might still be paying a hefty thing out of pocket due to deductibles, or, you know, it might be the only person who accepts your insurance, but your insurance only pays like 50%. And, you know, therapists we're not cheap. And I say that I'm no longer a therapist. I just want to clarify that. But if you're in private practice, many times, unless you are like independently wealthy, you are not going to be able to provide discounted services. And I promise you it's not because we don't want to, because many times we're like, oh, this sucks. Many plans limit sessions, they restrict providers, or deny coverage entirely. The other thing I see too is because there is such a problem with bad actors, sometimes they'll deny care that's needed because they feel like you're just referring something to see if insurance will pay for it. And the reality is, a lot of people, when they're referring somebody for a service, they genuinely believe that person needs a service. I have never, and a lot of my colleagues that I know in this field have never referred a service that we didn't think was necessary. And if somebody was trying to get a service, we'd be like, well, we could put in the request, but you don't have a very strong case, and it's likely to get denied. Because we're transparent folks here, but many times you can't put in a request for something without a bunch of documentation. And I'll just be honest, many insurances will jump over $1 to save a dime. And if they did a little more preventative care in listening to the people providing services, it probably would actually cost them less money. But, what do I know about that? So a sliding scale care does exist, but wait lists can sometimes be months long, especially in rural communities. And I will say that while our underserved population where I live has access to providers, many times they are overworked, their caseloads are very heavy, and you're lucky if you can get in to see them more than once a month, depending on, honestly, the economy. Sometimes you could see somebody every other week if they were lucky. And sometimes you might only see somebody once a month. And when I worked in a Medicaid accepting facility, I don't really know what they call it, but we were also responsible for case management as well. So I was the therapist, the case manager, the skills trainer. The only thing I didn't do was prescriptions. That would obviously come from the providers that, went to school, medical school. So they oftentimes have heavy caseloads. So if therapy costs more than rent, groceries, or gas, mental health is looked at as more of a luxury. And I kind of feel like that's part of the problem. That's part of the cycle. And emergency rooms at times can often become the default mental health care because people will delay their care until they're in a mental health crisis and they don't have a choice. And they might be forced, or they might have no other choice, or unfortunately, sometimes they don't make it out. And I think y'all know what I mean by that. And preventative support is not happening. They're just not getting the preventive support. So my next question is going to be, and you guys unmute or drop it in the chat, has cost or insurance ever stopped you from getting mental health help? Yes, therapy. And I think it's unfortunate too, because and this isn't necessarily related, and we may cover this a little bit later, but not really related to the finance part, but it is a high burnout field. I went to an agency whose SOP, standard operating procedure, said you shouldn't have more than 35 clients. I call them clients. I don't like to call people patients. When I left that job, so many people had quit. I had 110 kids on my caseload when I left. And I felt awful because we had to split that 110 between 7 or 8 other people. And I don't know what their caseloads were like, but it was hard. It was hard for me. Many times it was hard for me, the 3 jobs that I've left, to leave the clients. Especially because when you enjoy what you do, it makes it hard. And so that also kind of affects preventive support and delays in care. And those become barriers as well, so that when you do have access to care, it's really hard to get it. So yeah, I think that, so Canadian here, but yes, our healthcare has gone downhill. The thing is, you have geographic barriers. Now, this is one I did see. And I will say that what I really liked was we would drive to somebody's home if we had to. That was a service that could only be offered if they took Medicaid, or if they had Medicaid. But in rural areas like here, it can be hard to get the care that you need when I just looked at my graphic and underserved is spelled wrong. Don't judge me, y'all. We would drive to the patients, but what about the ones who didn't have Medicaid? So that would be a challenge too. And before this, I worked there before we had the big pandemic. And so telehealth was one of those things we didn't do that. We didn't do that. Now you could call on the phone sometimes, but they really wanted like that in person uh, treatment, basically. The other thing is you have, like I said, fewer providers, longer travel distances. I'm in a huge county because Arizona, we have big counties. And so we have cities, all of our major cities in this county are like 45 minutes apart. So you have Bullhead City, Kingman, and Lake Havasu City, and they're all about 45 minutes apart. Now, these Medicaid funded treatment centers do have facilities in each of those locations. But if you live in the in between areas, which there's a lot of in between areas, it could be harder for you to access care, even if they could come to you. You know, now you have to plan your trip as a therapist, however many minutes it's going to take to get there. Then you see them, then you have to drive back. Then you have low income urban areas, which often have high demand, overwhelmed clinics, short appointments, burned out providers. I think burned out providers fall in more than one category, but yes, in low income urban areas. And here's a truth bomb. Access is not just about whether care exists, it's about whether it's accessible, whether it's reachable. There is no point in having accessible care if people can't get in to get an appointment. It makes like there's no, if I have a clinic right next door, but they don't have an appointment for 2 months, that's still not accessible. So I think that also contributes to some of the barriers to care. Now, because of the pandemic, we do have telehealth and digital tools. However, can they pay their phone bill? Do they have internet? Are they in a place with a good connection? Again, I'm in a rural county. So there are times where certain places you're lucky if you get any kind of phone connection or internet. Internet can be weird. Like we could only get from one of two providers or satellite for our internet. And the two providers were butt. So we went with satellite and we don't regret it either. Not that you guys care. But anyway. All right. Telehealth is something that can help because it does reduce travel barriers. It does expand provider options. It offers flexibility for working families. And it is becoming a bigger thing. Like the pandemic changed a lot of ways about how healthcare is done. There's an app now called ZocDoc. You can find a doctor anywhere that accepts your insurance. You just plug in your information into that app and it'll tell you. And I think that is a byproduct of the pandemic because I don't remember seeing stuff like that before. Now I know we had like BetterHelp and stuff like that. And I've heard things about those I don't know enough about to speak on. And I know those were there pre-pandemic, but I do know that there was a lot of healthcare things that changed since then. But what isn't going to magically appear, even if you have the telehealth aspect of it, is internet access gaps. Privacy concerns. What if they're in shared housing? What if they're homeless? What if they have to take a call at work? And then you have the digital literacy, right? Not everybody knows how to use a smartphone. And so I think that can play a role too. And I think another aspect to this is not just the literacy, but one thing that a lot of people don't know. In the state of Arizona especially, it's probably like this everywhere, but in Arizona especially, if I am here and I am providing services, you also need to be located in Arizona physically. Now, there may be exceptions to that rules in other profession. There may be rules that have changed. But at the time that I was in practice, they had to physically be in the state. Like you couldn't just call me if I was on vacation. And that has to do more with, I think, legal issues than anything. So you also have that aspect of the telehealth where you can only provide services to the people in your state, unless you're a federal employee, and that's a whole other whatever. I think that also can cause issues with accessibility to care. But I also think that that's a really complicated topic. So we will just keep it a moving. So telehealth does help, but it does only help if the infrastructure and the trust are already there. Especially because when it comes to treatment, and it's probably like this in the medical field in general, you see me on the camera, but there are certain nonverbal cues you might not see because so much of me is in the camera. And that does play a role in assessment when you are assessing their body language, their mood. It's not just done on speech and how you're talking. Some of it is, are they walking fine? Do they look like they've had a few drinks? Do they look like they have medical issues? Because those are all things you use to assess if it's their normal, their baseline or not. So there's also some gaps in care that can occur because of that. All right. So my next question is going to be, have you ever used telehealth for mental health services? And what was your experience if you did? Had been seeing my doctor for 3 years prior. So I have done in person and telehealth, mostly because when I do see a therapist, they're actually in Henderson, Nevada. So I have to drive a little ways. And that's by choice. I'm okay with that choice. But there are times where sometimes we just do it over the phone instead of in person. I always try to go in person when I can. I do think it could be a good experience, but I've definitely had bad experience, especially because with the VA and probably a lot of other healthcares, when they do these, meeting has to be secure. And there, it's almost like there's like a 5 second lag or something. So they'll say something and you'll say something and then you're talking over each other. Then both of you are quiet and then it's awkward and then you kind of go back and so that's another thing that kind of makes it hard to do telehealth, but it's better than nothing. So it is better than nothing, and I'm not knocking that. We switched to telehealth because of COVID and just never went back in person. Yeah, I could see that. That's actually how we ended up doing online school for my daughter. For the most part, I think she likes it better. It's culture and stigma and attitudes. And this is where, especially you guys on the panel, I would love to hear whatever you're willing to share if you had certain preconceived notions about mental health or anything like that. So go through my little spiel, share a little story, and then if you guys want to share anything, you can. So, cultural beliefs and stigma can also play a role in access to care. And it could be because of things like we don't talk about that, pray harder. This one is funny. This one is funny because I had this generated from research in my little AI tool. And it's one that somebody I know actually used to hear. Therapy is for white people. And mental illness means weakness. And even if people don't say those things directly, they are something that people have thought or been taught or maybe have indirectly been led to believe. Okay. Stigma doesn't always look like shame. Sometimes it just looks like silence or not responding at all. And I think that's why this is such an important thing to me because I feel like we need to normalize the conversation around it. So, I'm going to share a story about stigma and cultural differences. I know somebody whose family actually did say that therapy was for white people, rehab was for white people. The person of this culture didn't do those types of things, and that trauma and mental illness was non existent within their culture. And 20 years later, they have actually, the people related to this person, have sort of turned that around a little bit because of things going on in their family. But also because with this person, they walked around with trauma for a long time untreated and became a drug addict. And it was a little bit of a cultural thing, but it was a little bit of, I think maybe pride and ego. Like they didn't want anybody to think there was anything wrong with somebody in their family. I think part of it was maybe like about looks. If you guys would like to unmute and discuss your thoughts, I thought we would ponder on this one for a little bit before we move on. What do you think about the cultural aspect of it?
Could have your problem. Anybody could have a mental problem. Uh, the area that I moved from, you would basically have to commit a crime to get help.
Yeah. Yeah, that
And it
sucks.
wasn't like the people. It wasn't like the people were intentionally. Some of them were intentionally committing crimes. It's
Right.
just they didn't get no help for the problem until they got locked up.
Wow. Yeah, and I'll probably discuss this more on like another live, but incarceration, even when treatment is offered, it's really not the same. I think the federal
No,
prison has federal prisons have a little bit better system, but state prisons are just they're lost. And even the
they
ones
do
that
the
try to
bad money.
model, yeah, and even the ones that try to model the federal prison, because the federal prison will offer 6 months off of your term if you successfully complete their treatment, but the states don't. So even when they do try to model off of that, the inmates don't really feel incentivized by it, especially because, well, and that gets, I won't get off topic, but that gets really complicated. It's because of yard politics and stuff like that can really complicate people actually being willing to get proper treatment. Well, okay, so with that being said, what messages did you hear growing up about mental health, whether it's religious based, culture based, ideology based?
Okay, so you're speaking my language on this one because I've dealt with anxiety since my early 20s and I was not allowed to talk about it. I could talk about it a little bit to my mom and like my mom would take me to like my doctor's appointments and stuff, but my dad did not want to hear one word about it because it was all in my head and it would just
Mm-hmm.
go away and I could wish it away and pray it away and all the ways that you could think of. And just for so long, I didn't speak about it. And I would actually get anxiety from the fact of I was hiding anxiety from everybody because I wasn't allowed to share what I was going through and what I was feeling and all that other stuff. And it wasn't until about, I would say, 6 years ago now that I just said, you know what? Everybody talks about their heart disease and their diabetes and this. Why can't I talk about my anxiety? So I just started talking about my anxiety. And I have to tell you how freeing that was to
Hmm.
just be able to say, hey, you know what? I do have anxiety. And if I leave you and you don't know where I went, it's probably because I just couldn't handle the situation anymore. And this is why. And that relieves so much pressure off myself. So I am very open about my anxiety and I talk about it to anybody and everybody that wants to listen and learn. So that's my
Yeah.
input.
No, I love that. And thank you so much for sharing that. There's differences across cultures, and stigma can actually show up differently across cultures, but stigma is also very isolating. Stigma leads to shame, and oftentimes that doesn't encourage people to get help. It actually can make their condition worse because it's untreated, but two, it isolates them so it worsens their condition because of that, or they feel shame, or how Debbie was sharing that like she didn't feel like she could talk about her anxiety. And then, kind of once she did, she felt like freeing. The stigma can be different, of course, also based on like family situations or environment, school. I mean, and that's the thing, like about people, we are so complicated that what works to motivate somebody might be different than what motivates somebody else. What helps somebody get sober might be different than what helps someone else get sober. Like, we are just literally so complicated as a species. Some cultures tend to externalize distress, and that can come through in physical symptoms. You might have, like, where when you're struggling with depression or anxiety, you feel physical symptoms. I know, like, if my anxiety is too high and I tense up too much, I feel it back here and it just gets really sore. And I use a magnesium oil to help relieve that. Not a CURE, okay? But it is something that helps alleviate that, and I think it is probably nutrient related, which is why it works. But some people get stomach aches, some people get earaches, headaches, migraines, things that they just can't explain. They go to the doctor, they get checked out, and there's nothing wrong with them. And the very first time I ever had a panic attack, I went to the ER because I thought I was having a heart attack. And I got there and everything
Me
came back
too.
clean. Yeah, everything came back clean. And they were like, we think you just had a panic attack. So now I know that that's what that is and I don't have to panic every time. And then I'm like, God, if I ever have a heart attack, I'm not going to know. Because it's almost like my body's playing the boy who cried wolf, right? But And so now I've learned to kind of like work through it, and mine will hit me out of nowhere. But if I would have went, and they were very, very kind about it. I want to say that because medical gaslighting exists. They were very kind about it. Had I gone and they treated me like I was just a hypochondriac, I might not have responded the same way. Faith leaders in spiritual environments. And this is not to knock anybody's faith, because that's not what we do here. But there are some things that come with some faith-based approaches that may lead to stigma or may lead to somebody not getting the proper care. And it's really happens because your pastor, you want to trust your pastor or your priest or, your deacon, whoever in your church, and you want to trust your higher power, Jesus, God, whoever, right? That they're going to help you through it. But sometimes it's not that simple. And it's also kind of, they're also kind of a place where people culturally translate. And I say culturally, but I really feel like I mean more community, because when you think, well, I guess it would be culturally, because when you think about it, right, your family is its own culture. You guys can talk to each other, give each other a look, and you have your own unspoken rules, your own unspoken conversations, like certain things are done certain ways because it's your family. And then you think about your community and your friends, and you have that same thing with them. If you go to school or you go to church, the same thing applies. So your main culture might be at your home, your house, who you are, where you're from, but then you maybe sometimes are over here in this culture, which is this religion, this church, this belief. And you might be over here in this culture with these friends who they identify this way politically or educationally or financially. And so I guess it is culturally. It's just, when I think of culture, I always think of like people's ethnic backgrounds, and I think that's what messes me up a little bit. So, these are often the first point of contact too, right? So if you're somebody who goes to church every week, and then say your child starts acting out, you might go to the pastor and be like, can you pray for us? We're struggling with this. And we're not necessarily getting to the root cause that way, right? And that's the thing. We are only human. You can pray so much and you can have faith. I'm not taking away from that. But you also have to be able to find the root cause. What is causing this behavior? Is your child not communicating something to you? Something like that. And I say this as somebody who has struggled with, sometimes we don't know the root cause, and it's like, what do I do now? Right? So a more effective approach would really be to look at it like this if you're coming from the spiritual angle, and that is mental health care does not replace faith. It can actually coexist with faith. And I don't know if you guys have been here for my longer speech that I used to give before these lives, but I used to go, I have a master's degree in Christian counseling of substance abuse and addictive disorders. I had a minor in Christian counseling. I took it because it was the longest course possible, and I didn't know if I was ready to be around people again. Okay, that's the reality. But I went to a Christian university. I was raised in an Adventist home, so like religion is something. I'm very familiar with spirituality, God, everything. And that's actually where I learned that you can have faith and therapy be somewhat symbiotic if you know what you're doing. Prayer and therapy, they're not in collision. They can actually be used together, right? Because prayer and therapy are both ways of expressing our concerns, our gratitude, what went well, when you think about it, right? Because what do people do when they pray? I mean, unless you're somebody who only prays when like something goes wrong, but a lot of people pray like a lot of times, not just when something goes wrong. And so it's very similar. They're both tools, and so they can be used. So, if you do have a faith-based counselor or something, they can incorporate whatever your beliefs are right into your therapy if they don't work for a secular company. Some companies do not allow faith discussions. Representation and cultural competency. And this is actually probably one of the bigger barriers that I see. I was just talking to somebody about this the other day. When you think about schools and you want to go to school to be a psychologist, you have to go, in most states, you have to go to a school that's APA accredited. That's the American Psychological Association. In those schools, you have to physically go in person to those schools. That's not accessible for everyone. And yes, there are some people of not white ethnicity, not white, um, race that might get into those schools. But when you really look at the numbers, it's going to be upper middle class kids of people with better finances in most cases. So even if you're getting a little bit of diversity and you have African Americans and Hispanics and whites, you're not having as much diversity in maybe the financial aspect. And I know that's not true. I'm just speaking in examples, so please don't eat me up for the generalizations. But if people had the ability to do the schools online and do their residencies in person, which is a great way to learn, I think it would open up the doors. Now, there are some schools that do that. I went to a school that did that. You had to go to residencies every single month. And then when you got in your internship period, it had to be in person. It couldn't be online, and things like that. But you know what? When I went to that school, there was a lot more diversity than what you see if you just go to the average college. And then you have to consider like student loans and stuff like that. People don't want those. So that's a barrier as well. So that's another reason why you're going to see certain socioeconomic backgrounds in these schools getting these educations. I think that it's a disservice really to the community as a whole to limit how people can learn, because it's also causing a shortage in this field that is in such high demand. And that's another rant for another day. But the other thing is, people heal faster when they feel understood, so language matters. If you only speak Spanish, are you going to want to do your therapy through a translator? No. I mean, yes, we can offer that as a service, but it's going to make it impersonal. You're not going to want to tell a translator everything, right? It's kind of takes away from that. Or maybe you do speak English, but you're more comfortable in your native language. And so you would do better if you had a provider who spoke your language. That's something where there's a shortage as well. Cultural context matters as well. I did not learn this until I went to college. Mind you, I'm extremely white. Look at me, pasty white. And I grew up in a town where there was a lot of immigrants in that town. And the town has grown so much, it's a lot of white people. They've totally colonized the place. But I didn't realize that we learn microaggressions from a young age. So things that, and it's because it's so ingrained, people have been doing things for so long, they don't even realize it's a microaggression. And one I can think of is, this is crazy. And I wasn't offended, but it was a great example. I used to work in Target, and I had my hair really dark and I had makeup on and everything, so I looked different. Sometimes people mistake me for being Latina. So this guy came up and he's like, "Do you speak Spanish? You look like you speak Spanish." That's a microaggression. And that's why having a provider who maybe understands your culture or your language or something like that can be better, because you don't want to accidentally offend somebody when you're trying to help them get better. Lived experience is also something that is important. One thing I see a lot of is peer supports in a lot of programs now, and I love that. I love that, especially because a lot of peer supports are people in recovery for their mental health or addiction, and so they're more relatable. And they're more relatable because sometimes your therapist, you may feel like they don't understand, which I promise you a lot of times they actually do. A lot of us came to this field that I used to be in, that I'm not in anymore, is we are natural, we want to help people. And then we learn a lot about ourselves in the process. But what happens without representation, like having a Spanish speaking therapist or Mandarin or whatever the language is, it can lead to misdiagnosis, because things can get lost in translation, things can get misdiagnosed, things can be misunderstood. You have sometimes dismissal of trauma because it may not translate the same in another language. And then you have people who maybe they drop out of treatment because it's a lot of work to go to treatment when people don't necessarily understand what you're trying to communicate to them to get better. Now, I will tell you, a lot of therapists are required to take cultural competency courses. And if I had somebody that I had never been exposed to their ethnic background, I would actually try to do research so that I could be mindful of things that I said or did that might be normal in like traditional Western medicine, but might be offensive in whatever their background is. But sometimes you're having to treat somebody in a crisis and you can't just go Google something real quick to make sure that it's okay, right? So it's still an issue, and the goal is at the end of the day to try to minimize it. What competent care is supposed to look like. You guys know I love talking on this subject. If you've been around for a while, love talking about competent treatment providers. And that is asking questions, not assuming. So I always like to think of it like triaging, even though they're already in your office, they're already in your chair, whatever. And you're asking somebody and they're telling you about their day, you are asking questions. One, you got to show that you're actively listening. But two, you don't want to assume that because they said something, they are a certain something. But you also have to understand systemic stressors. And this is one thing, and it's one thing that I think is really important to understand. I grew up in a middle class home. We didn't have a lot of money, and we should have had more money than we did, but families are complicated, right? However, I was never so stressed out or so strained or whatever that those things would impact my mental health if I had a therapist, right? But let's say you have somebody who immigrates here from another country and they don't even, it's a little bit of a culture shock, right? And then something happens and they need treatment and they're not maybe comfortable speaking English, or they feel like they're being judged because their English isn't that great, or something like that. And maybe they're part-time workers, maybe they lost their jobs, maybe they came here for work and the job fell through, whatever the reason is, right? They're an immigrant, they're here, and people are already judging them, whether it's racism, whether it's, financial judgment, like, oh, look where they live, other side of the tracks. Okay. I'm proud of the side of the tracks kid, by the way. You take that into account with whatever language barriers they have. That's going to make their care difficult too, because even if they're willing to come in for care, it might not be as well for them because they're working against all of these things that are already going against them. And I feel like there's a better way to word that, but we're just going to move on because I struggled with describing that. Competent care is respecting family and cultural norms. So if somebody doesn't make eye contact because it's a culture thing, then you can't be like, oh, there must have been something traumatic that they don't want to make eye contact with me. No, like that's their culture, right? Because that can lead to, misdiagnosis, which can lead to improper treatment on occasion, not always. Sometimes it's not serious, but it's important to have those details. But the reality is this. Cultural competency courses are not going to be enough because it's going to be an ongoing process. Because at the same time that you have cultural differences, you have societal changes, you have economic changes that affect everybody as a whole, but they affect different people differently, right? So it's ongoing work. You can't just take one class and be like, now I know how to treat, African Americans because I learned this, that, and the other. Like, no, you have to constantly be learning. As the provider, that is something that can be a barrier to your client's care, but also to their willingness to come in. And I say this because these barriers can literally cost lives. They can cost lives. And that's the ugly truth is if somebody can't get help and they can't get help that is respectful of their identity, they may just not get help at all. And even if they don't necessarily do anything to themselves, they might have reckless behavior. They might go get a DUI and hit somebody, and so these are all things like the conversation is so complicated and I could literally talk about this for hours. And I'm talking to you guys like y'all are going to be therapists, but I'm just trying to give you like the therapist perspective of why that's a barrier and why it's so important. And one thing I want to say with this also, if you are getting treatment and you feel culturally disrespected or you just don't vibe with your therapist, you can ask for a new therapist. They're not going to get their feelings hurt. And if they do, then you shouldn't be with them as a therapist anyway. Certain personalities don't mesh. If somebody disrespects you and you want to correct them and stay with them, that's fine too. Some people are willing to learn from their mistakes. But if you feel like they're constantly saying things that show a bias, you can always ask for a new provider. Have you ever felt misunderstood by a provider for any reason? It doesn't have to be any of the things that we've talked about so far. I have two. Misunderstanding was a little bit different, and it was more related to substance use because I had a medical condition. They didn't want to take my pain seriously. And then we found out like it actually was a problem later on. And I think here's the thing. We're all human at the end of the day. So a provider could misunderstand anybody. But it does make it a little easier if things get lost in translation or address certain things. Context matters, and when it comes to historical injustices and medical mistrust, context matters. What are things that people have experienced? Exploitation, discrimination, forced treatment, and over-policing of mental illness. And the problem is, we always go to the extremes when we're creating policies for these things. We either release everybody or we lock up everybody. And the system doesn't seem to have room for a case-by-case basis, so it's either all or nothing. That's very broad, it's very general, but that's just how I feel about it. Now, some people have to be forced into treatment because they are not safe to themselves or other people. But you do see exploitation. You see if you've ever seen the movie Body Brokers, people really do that. People really do that. A few years ago here in Arizona, people were going to New Mexico, picking up Native Americans, saying they were going to put them in treatment. They'd get them here. They'd get their tribal medication card, their tribal health insurance. They would drop them off in the street corner with alcohol and leave them homeless and then bill their insurances if they were in treatment. That allegedly, that was all alleged. Exploitation does happen. Then you have people who... I think my husband told me, I would have to ask him, but I think he told me that when he was born, he had to go to his mom had to go to a hospital different from white people's hospital. I'm pretty sure he told me that. Now, if I'm wrong, I do know that was a thing. That's discrimination. And even if we can all go to the same hospital, that discrimination does still exist. Not saying everywhere, not saying all the time, not saying every person, but it does still exist. It exists in a sense that when you look at childbirth, the amount of deaths of minority women is higher than it is for white women. And the amount of things that could have been prevented from them dying that were not addressed is a little bit higher. There's actual studies on this. I need to come to the table with some receipts on some of these things that I'm sharing because your girl is a nerdy little researcher. So mistrust isn't going to be, so the mistrust of the system isn't paranoia, it's learned, right? And some of the social determinants of health, and this ties right into what I was just saying, is housing instability, food insecurity, racism and discrimination, language barriers, constantly living in chronic stress and survival mode. Those are all things that are going to be barriers to getting mental health. You cannot mindfulness your way out of systemic harm. And I know this is not my normal, let's talk mental health and make it more personal, but I feel like it's an important message because my goal is to normalize this conversation. And I want people who maybe don't know these things to feel like they're learning something so they can see it in their communities. And even if they can't advocate, maybe have a little more compassion about some of the things maybe they see. Also have policy gaps. And we talked about that a little bit. They seem like they're really extreme or there's gaps. And then when the policy does exist, it oftentimes doesn't favor the things that would be beneficial to the people with the mental health issues. I know this is controversial and we don't get political here, but expanded Medicaid coverage would help. I also think we need to start treating mental health like a health condition, just like I think we need to treat dental and vision as if it is a physical health thing. I really, really dislike that you have the doctor for colds and flus and, whatever ailments you might have, but they don't seem to consider vision care and dental care, which dental care is very important to your health. If you have bad teeth, it can make you really sick. They don't, and mental health is important to your health. If your mental health is bad, your regular health is probably not as good either. If your regular health is bad, your mental health is probably not good. All of these things really should be part of one system where we're getting the whole person care. And there are places, I can say that the VA that I go to is trying to address that aspect, and I love it. I really hope that other systems that other people have access to, because they don't have access to the VA, really hope that we start seeing this more places, because all of those things matter. Eyesight matters. If I'm walking into the wall and breaking my nose because I can't see, well, that's going to affect my health and my mood, right? I know that's like a dramatic example, but I just think it's so important. You have mental health parity enforcement. You see, and I'm sure we see this a lot, especially with the media, where some people go out and do something wild in a mental health crisis or whatever, and it's really hammered on. And you're going to see, if you really pay attention, certain types of issues are put into the news more than other types of issues. The same type of issue, but maybe another race or another gender or something like that. The mental health parity it's there. It's there. Community-based funding is very common in a lot of areas, and that's why sometimes these smaller communities don't have the resources they need, or their resources are limited. And loan forgiveness for providers serving underserved areas. I really think that if you want more providers, you have to make education more accessible, whether it's financial or whether it's by not requiring them to go in person, not requiring them to go in person to school, or having like more options for night school and weekend classes, more part-time options until they're ready for the internship. Because a lot of things could be solved if we had a little flexibility somewhere. Those are just, and this is just my opinion. If we all had access to health care, this could help. But if we all had access to healthcare and we're still short-staffed, we're still going to have trouble accessing the care that we need. Solutions and hopes. What are some things that communities are doing to help provide more accessibility to mental health care? Well, I can tell you in my community, we have the crisis response team. It's a mixed bag for me. I've seen, and that has to do with my state in general. My community, the crisis response team, there's never enough people. They can't always respond to crisis fast enough. They're underpaid, overworked, and they're actually, if you call the crisis line and you are like, I'm not okay and I'm going to do something, they're the ones that are supposed to respond. And then they're the ones that have to refer you. And if you have insurance, it has to be done a certain way. I like the idea. I like the concept. And in theory, it should work. But if we don't have enough people providing those services, you could lose people along the way. And that's the part that makes it really difficult. Now, I've seen in bigger areas where there's access to a lot more people and a lot more services, and the crisis team will be there like that. And it's amazing, and they offer a lot of services. Here, they don't really offer a lot of services. It's like, okay, we'll follow up with you tomorrow and see if you're still in crisis. Yeah, and that's, if you call the national crisis line, they're going to do this and this and this, and you're going to get somebody that's local. And where I live, it may work and it may not work. But it's a better solution than having nothing at all, especially because we really don't want to be calling the police for mental health issues. I think something that would be beneficial is to have more mental health liaisons in police departments. If you see somebody that looks like they could be a victim of domestic violence, if you have somebody who was a victim of domestic violence, if you're dealing with traumatic scenes, or you're dealing with somebody who's in crisis, that liaison could be the reason that the police stay safe and the reason that the person that they're out there to see stays safe. Is it going to fix it all? No. Is it going to fix every problem? Absolutely not. But I think it might save lives. It might save lives. And when you think about it, you think about the Gabby Petito story. She literally was showing all the signs of an abused partner, but because she was hysterical and her boyfriend was so calm and chill, the police misread it, because not all police departments are trained to understand that she could be a victim of domestic violence, right? Or abuse, or, whatever you want to call it. And so I think that's why we need more mental health liaisons. Or, we have people that are in a mental health crisis getting harmed, losing their lives over misdemeanors sometimes, right? Mental health liaison might be able to say, hey, I think I might be able to talk to this person or whatever. I also think that culturally specific programs, and I don't say this like in a they should be segregated way, okay? So please do not misunderstand me. But I do think if you live in an area, okay, so where I live, there's a Native American tribe probably about 30 minutes away. And they do have their own healthcare system. But for the sake of this example, okay, let's just say they didn't have that. Would it really hurt to have one of the clinics here have a department that covers just Native American health and understands their particular tribe and their particular issues? Probably wouldn't. Now, again, bad example, because they do have their own healthcare out there on their reservation. But if we had maybe a section that's just for Spanish-speaking people, it's not going to cover all of every type of Spanish person, Hispanic person there is, but it's better than nothing, right? I think those things would help. Integrated care models, which you just heard my whole tangent about that, like mental health, vision, dental, all that should be integrated. And the reason that this is beneficial in more than just that you're taking care of yourself as a whole, which is why I think insurance should cover all of it too, is the fact that maybe you go see your doctor and you find out you have what is it called? Atrial fibrillation, right? And then you go and you see your mental health care provider and they're like, well, I think it might be anxiety. But then they're able to see, they can, collaborate with your doctor. They can do team meetings, whatever, however it wants to be run, right? And they can say, oh, it's not anxiety. They actually have atrial fibrillation and it's probably causing their chest to feel this way. And that's what's causing the anxiety. And they can maybe try alternative treatments before just try this, try that, get a med, whatever. And I'm not against medication. Okay. Please don't get me wrong on that either. I'm not against medication, but if you have all of your providers communicating in the same little chart about you, imagine how much better your healthcare would be. You ever had a referral and you go to the place that you got the referral and then like they can't do something. So then you have to go back to the person who gave you the referral, even though you're there for that thing. And like it could help eliminate some of the back and forth. And that's another thing that could save lives. It could save lives. And that's for all health. That's not even just mental health, right? All right. So some other things that would be helpful, and I talked about this a little bit earlier, peer support and community healing. And that's because it shares experience, it shares relatability, building trust. I think that's why communities on TikTok like recovery talk, prison talk, mental health talk, book talk. I think that's why these types of communities work, because you can watch somebody's video and see that their story reminds you of your own, right? It also helps reduce isolation. You find your community. You find your community. I found so many people in the recovery and mental health space here. And some people you may not even know are in that space. I've been surprised a few times when somebody's like, oh yeah, like I have mental health issues or I'm in recovery, and they just don't talk about it. And then you find them and you're like, oh, cool. Like that's really cool, So that community can be what's helpful. It also gives you like that accountability. Say you can't have, say you don't have insurance, but you need somebody to come sit with you because you're in a crisis. Now you have a friend, right? So I think the goal too is like peer support, integrated care. These are all things that complement care. They complement the care. They don't work against it. They work together. So early intervention is one. I think that children's mental health in this country is a disaster. It's a disaster in a way that I can't even fathom a solution to suggest for how it should be addressed. And I think it is something that needs addressed. But I think that if we did more when kids were kids, we would have a lot less adults trying to heal with bad coping skills. I think that being able to ask your kids, like, are you angry? Teaching them to label their emotions instead of, acting out frustration or whatever. Are you angry? Are you sad? Are you upset? Are your feelings hurt? I think those are all things that would be beneficial, teaching kids those things. I really think that the communication in childhood would be extremely helpful. Because even if, say, they have mental health issues like depression, anxiety, trauma, just being able to communicate could go a long way. Or feeling like they have open communication, I feel like could go a long way. And support should meet people where they already are. And you guys have heard me say this all the time. That's my whole thing. I meet people where they're at. And I took this philosophy from my therapist background and I apply it to my business. And if you come to me and you say, Jamie, I want to be part of your agency, I'm going to be like, are you the person I need to handhold, or are you the person that kind of knows what you're doing and you just need support? That's how mental health should be. Do you need like hand-holding care? Or do you just need support once in a while to stay stable? Okay. Community-driven solutions can be helpful because nothing can be done to fix the system without us trying to help fix the system. And I say us collectively because in our communities, in order for us to have change, we have to push for change. And oftentimes, if you see one person do something and you agree with it, you'll start seeing a whole grassroots movement. A lot of times, communities know their needs, they know their wants, they know what they want. We shouldn't have outsiders coming in trying to control the system when they're not part of the community, right? Like corporations, we don't want corporations controlling how our mental health is managed. We want our community to speak for itself. And I think we're in a place, especially politically, geopolitically, where we are going to start seeing some of these younger generations push for the community collective type of changes. And I kind of hope that's what that is. I think what gives me hope is that this is something that we are seeing discussed more, and people are starting to build solutions from the ground up. My kids are in therapy. One is an individual and social group. That's amazing. I love that. That's amazing. So if you guys want to unmute and share something.
Well, I thought this was really good. And I know that dealing with the mental health issues and the whole fact of just how difficult it can be sometimes to get that help that you need. And I think one of the things that I've been faced with lately is these young kids that aren't getting the mental help that they need, and they're finding other ways to cope, and they're getting into drugs, and they're self-medicating, or they're drinking alcohol, and it's really sad to see. And some of them don't even want to talk to their parents about it. And I'm thankful my kids will talk to me about their issues and stuff. But even with my one son, he also deals with anxiety, and his dad is one that, he can't even talk about it to his dad, because his dad is one of those people that thinks, oh, it's all in your head and it'll go away. You just have to be a man. You just have to be a man. He doesn't understand that it's more than just being a man. It has to do with the way he feels and what he's going through. And it makes him feel bad when his dad is telling him, oh, you just have to be a man. That's the answer. You just have to be a man, and don't you go on any kind of medication. So my son struggles with even wanting to get help, but he knows that with me, I'm very open to it, and it's just really, really hard. Yeah, that was your ex too, and you fight with it. Yeah, exactly. And that's the whole problem, is you have to be on board and understand that these kids live through a different time, and everything's on social media, and everybody has these wonderful lives, and they're making all this money really quick, and the kids are seeing this. And when they start to take jobs and they interact with people and they do all these different things, and they're not getting that instant results, walking around with $100 bills drooping from the pants, they go into these depressions and they just don't get it, and it's really hard. So I just think that there needs to be more out there in general as far as helping people in society with mental issues.
Oh
That
yeah. Yeah.
yeah, it's too much.
And Brad says, why don't people understand depression is what I think he's trying to say. And you know what? I think that the reason people don't understand that all ties back into stigma. And they're either stigmatized because of where they live, how they live, who they know, their background, whatever. But I also think it's because I know I grew up in an era, and my mom never made me feel this way. So this is not a testament to my family, but I grew up in an era where you weren't depressed, you were lazy. You weren't anxious, you were antsy, or you were, a hyperactive kid that couldn't get a diagnosis for ADHD because that was just normal. She was just, she was just a chatterbox or whatever. And I think like that is going to take years for us to undo. But I do feel like the younger generations give us hope in that aspect. And it is very hard to go through. It is very real. And that's the other thing too. And I want to point that out. Thank you for saying that, Brad. People invalidate depression. People invalidate depression. And yesterday we were talking about the difference between like grief and depression, and how like when you're grieving, you oftentimes get a lot of support and then everybody goes home and you're by yourself, and sometimes it can lead to depression. But people are bringing you food, right, after somebody passes away. When you're depressed, people are like, why can't you just get up out of bed and clean your house and take a shower and go to work? You're just being lazy. The mindset on those two things is different. Yeah, I wouldn't wish, and I've had one time in my life, and it was about 4 years ago, crippling depression. Now you guys see me, you see how much I talk, you see how fast I talk. This is how I always am. I drive my family crazy. In fact, my mouth moves faster than my brain sometimes, and I mix words together. But I had depression so bad, I couldn't even talk. I couldn't even talk. And that's why I was like, I know I'm not okay, because you usually can't get me to shut the fuck up. I think you're asking actually really good questions. My doctor keeps telling me so here's the thing with bipolar, there is no cure. There's only treatment. But you can do some skills training and stuff like that. But I have a family member who has bipolar, and even on medication, when he's in his manic phase, there is nothing you can do to stop whatever he's got going on in his brain. You might be able to get him to walk. You might be able to entertain him briefly, but then he's right back to where he was. And then when he's in his crash phase, that's what I call it, he might sleep for days. But then he'll have long periods of time where he's stable, but then he'll go manic again, and there's nothing you can do. And I think that's like the hardest thing. The depression is the worst part of bipolar. I would say that I agree with that. I know my family member and several other people who are bipolar, and I'm going to be honest, I wouldn't wish a mental illness on anybody. Not trauma, not depression, not bipolar, not anything. I wouldn't wish it on anybody. But I will say, with or without mental illness, there's no such thing as normal. And I remember being in one of my more depressed states. I don't have bipolar, but I do have PTSD. In one of my more depressed states, I said, I just want to be normal. I just want to wake up and live my life like other people do. And I do wake up and live my life like other people do. But unfortunately, I wake up and live my life in the category of people who struggle with our mental health. And that's all there is to it. And I like to always say, I have to find humor. Okay, I have to find humor. When you've had enough trauma and depression and bad shit in your life, you just find humor in everything. I've even learned to be grateful about the most ridiculous things, because you know what? If that was the worst thing that ever happened to me, I would have it made. And I love to say that. But humor is how I survive. And I always say mental illness doesn't run in the family. It stops to say hello to everybody. It hangs out for Thanksgiving dinner, man. And that's the reality. And I think anybody from any background at any time, no matter what their finances are, could end up one day just having a mental health crisis. And sometimes it's brief, and sometimes it is lifelong, and sometimes it's suddenly onset and never goes away. It's really one of those things that because we're all so different, we're not going to know. How I'm affected might not affect somebody else with the same diagnosis as me. Their trauma might be worse. Not that we should be measuring traumas to see whose is worse. Their symptoms might be worse. Their healing might take longer. Their brain may say, I can't even process that enough for you to try to heal. You know. So I think it's really important. And but I'm really getting in this, and I say this all the time too. I'm a humanist. I'm a humanist. And I don't think we should be leaving people behind. I know that it's not something we can fix overnight. And I know that it's probably impossible to think that we can help everyone. But I think at the end of the day, even if people are always going to slip through the cracks, we could be doing so much more to help people who are already slipping through the cracks that people just don't even think about. And that was kind of my mission with sharing what I shared tonight. And I know that some of it was like a little clinical. I know some of it was really from the therapist point of view, but I wanted to make sure that we talk about it because I was going through podcasts and episodes and audiobooks, and I just realized like there's not enough layman's terms about people who can't access mental health care. So, any other thoughts or feedback before we wrap it up?
I just want to say this was really, really good, Jamie. So I appreciate the whole conversation.
Awesome. Well, thanks for being here. So, 4 days a week, I'm going to be on 3 times a day discussing mental health issues. However, this is going to be my set live time every Tuesday night at 6 p.m. And the rest of the week it's a crapshoot. So if you see me on 3 times a day, I'm talking about something mental health. I realize that's what I'm passionate about. It's what I can't shut up about. And I need to go live more. And that's what I'm going to talk about. So y'all are stuck with me. If you have something you want me to talk about or discuss on these lives, you can drop it in the chat. You can put it in any one of my videos. You can send me a DM and I will discuss it. Do try to research as much as I can before, and I do want to start showing like where I'm finding my information. We don't have it all finalized yet. Okay. So hi Argenis, we miss you. Everybody say hi to Argenis. Argenis decided that he was going to take like a 42-day vacation and we haven't seen him in forever. He was like, I'm going to make a whole bunch of trouble and then I'm going to leave you all and then I'm going to just come back one day and surprise you. No, it's been nice. I'm really happy you're back, Argenis. Really, really happy you're back. See him live, stop by his live, show him some love, tell him to stop being a troublemaker, whatever it is you got to do. All right, guys. Well, if we have nothing else, I will see you, I'm sure, all tomorrow. And you guys have a great rest of your night. And thank you so much for all of your participation.